So hi, everybody. Thank you for joining our last of the Working with Families Virtually series. We are really excited to have you all here and to have Molly kick us off with a presentation. As just a quick introduction, my name is Sabra Inkner and I am with AmChip. And we will just have a short presentation from Molly with Expecting Health at Genetic Alliance. And then we will have discussion opportunities for questions, conversation, feedback from peers as appropriate. We do have the closed captioning available. If you have questions about how to turn that on, please do let us know. As Molly is presenting, feel free to drop questions into the chat, both if you have kind of immediate questions or if there are things that you want to discuss after the end. And with that, I just want to thank CDC for their funding and support of this, and note that obviously nothing that we say represents them or anybody else. So thank you so much, and I will pass it to Molly.
This is Molly. Thanks, Sabra. So before I get started, though, I just wanted to introduce have them say a few quick words to introduce themselves, my other co-hosts. And so Candace, I'm just going to pass it to you to just give a quick introduction and stuff.
Sure. Thanks, Molly. Hi, everyone. This is Candace Lindo-Davies. I am the Director of Outreach for Hands and Voices headquarters and the parent of an adult young man who is deaf. And I'm just so happy to be here to talk about the topic that Molly's going to introduce us to. So thanks for letting me join.
Hello, everybody. I'm Sarah Kennedy. I'm a colleague of Candace's at Hands and Voices. I also have a young deaf adult, one of my 4 kids, who brought me into this journey. And at Hands and Voices, I'm the editor of our quarterly newspaper, and I have a few other roles as assigned. Let me pass the baton to Marcia.
Hi, everybody. I'm Marcia Quinn. I am the co-executive director for Parents Parent USA. I'm living in Washington. And I'm excited to see a lot of my Alliance members out there today. So thanks for joining us. And I'm also a parent, first and foremost, of 2 boys with autism. So thanks. I'm looking forward to your presentation, Molly.
This is Molly. And again, thank you for introducing yourself. And again, I can see a couple of comments in the chat around captioning and stuff like that. You should be able to access the captioning if you hit the live transcript. That was requested for this meeting and stuff like that. But I am going to get myself started, introduce myself quick, and then I'm also going to do, like we said, a small presentation. I want you guys to know that feel free to jump in, put things in the chat if you have any questions. Otherwise, we can get to them to the end as well. And what we'll do at the end is try to have a facilitated discussion around how we're supporting families virtually through these past couple of years, which I can't hardly believe it's already been a couple of years. We keep saying this, but we keep learning new things all the time. As I go to share my screen, let's see, I hope this all works. All right, so there we are. Like I said, my name is Molly Marsky, and I'm with Expecting Health at Genetic Alliance. There I am the senior program manager, where I get to coordinate with the National Genetics Family Education and Support Program. We like to just call it the Family Center because that's a lot to say or spell. And yeah, so I came into this work. I am a family leader as well. I have 3 young adults. We just moved my youngest to college yesterday, and my youngest and my oldest are deaf. So that's kind of how I came into this. Been lots of journey, worked in lots of different capacities, whether that was with our state Title V, children and youth with special health care needs. I worked with Hands and Voices for a while. And now, like I said, I'm with Expecting Health. So today I am going to talk to you guys a little bit about the Family Center and some of the programs and projects that we have developed in our offering. But first, I want to put this out there. It is a federally funded program, so it is supported by HRSA. And here's our award. Again, just to let you guys know that. So before I kind of start talking about it, I just want to talk a little bit about where the Family Center lies within HRSA's division of children with special health care needs. So they service a lot of different things. And a lot of people are familiar with sort of the family professional partnerships, the F2Fs, all of that, and so a lot of that falls under that systems of care. But we fall right here under the genetics program. So I always say we're kind of like we're all related in some way. So a lot of what our objectives are may look familiar based upon what your familiarity is with some of those other HRSA funded programs. But that's where we sort of sit in the HRSA family under this genetics programs. And there's really three HRSA funded genetics programs that we kind of focus on. So there's the National Genetics Education and Family Support Program, that Family Center that I talk about. There's also 7 regional genetics networks, RGNs we call them. And those RGNs they cover all of the 50 states as well as just a couple of the territories. So not all of the territories, just a couple of them. And then there's also the National Coordinating Center for the Regional Genetics Networks, the NCC. And so the 3 of us sort of offer this system of care, the support for families who have been identified who are at risk for developing a genetic condition. So as sort of this overview, like I said, the Family Center really is been established to help support families that are at risk or have a genetic condition, and really so that they can be active participants in their own care, or that they can serve in leaders as part of the system of care. We do this, we kind of were charged with 4 different program goals that we have to do. So we really look at providing culturally and linguistically appropriate education and resources on genetics and genetic conditions to families. We provide technical assistance to those RGNs. So we're really trying to help support them on how they can incorporate family leaders within their work and what they do. We look to train individuals and families so that they can become family leaders within this genetic healthcare delivery system. And then we also want to provide support for families and individuals so that they can be those equal partners in their own healthcare. We could not do this work without our partners. So we work with a lot of different groups such as AmChip and all of that, but we do really have 2 named partners that we spend a lot of time developing this with. And one of those is SPAN, the Parent Advocacy Network out of New Jersey, and then as well as Parent to Parent USA. Marsha's been a great partner of ours, and she's on this call as well. So a couple of resources that that we've developed that I want to talk about. I'll go through them a little bit in detail just so you kind of know what we have, but we have got a website. We've developed a podcast. We really focus on that peer-to-peer learning. So I'm trying to support family leaders and learn from one another because we feel like that's a great source of information. We produce webinars, and then we also have our leadership trainings. So this first picture is really a picture of our website. So we were charged with creating a website, actually specifically under this, our last funding. And so we really wanted to pull together a website that we felt was both informative and accessible to families. I always joke that when people start to talk about genetics, especially those in the genetic fields, they're so passionate about it that they always start with the science of it. And it's sometimes not exactly where the families are at that exact moment, or even their desire to learn some of that. information. So we really tried to set this website up as a way of families to learn about genetic information and genetics with being where they're at, as well as their level of interest. So we kind of set it up like, here's sort of what you need to know to really sort of the basic fundamentals. Then, hey, do you want to know a little bit more? Here's a little bit more that you can learn about it. And then finally, you know, do you want to learn a lot more? And here's some more in-depth, as well as some different places to go. So, and we really talked about where you are on your genetics journey. So whether people can get into this genetics sort of field in a number of different ways, whether that's through maybe, you know, a newborn screening, something that came back through newborn screening, but it can also be actually a journey that families are on where they maybe actually never get a diagnosis. So it's really wherever those families are, and we're trying to meet them where they're at. So we really have that information about genetics on here and that journey. But then we also tried to share, you know, about that family leadership piece. So that's really our next section that we kind of just recently developed. And so we really look at this family leadership as a journey. And so we look at it within really 4 different domains. So this is just a screenshot of sort of the website on that, if you click on that family leadership tab. But really, we're looking at it at that basis of the individual. So really, what is that your understanding? So of being a family leader. And so we really tried to collect a couple of different types of materials. We know that people learn differently, or they get information differently. So, and they have different amount of time that they can commit to this. So we wanted to do articles about it. We also wanted to do some videos about it. And then we also did some online learning modules around that as well. So, and we took it under these 4 different categories. So we have the individual, and that's really where we talked about like, who is a family leader, and really recognizing yourself as a family leader. Then we moved to the community, or no, the family. So just a little bit out further. So, right. So being a leader within your family. And so that was really around navigating that genetic diagnosis. And then we moved out to a broader circle of community, where we started to talk about telling your story and what that looks like. And then the last one is really at that systems level. And so we created some modules and some stories around that as well. This is an example of who is a family leader. We set it up. You can see all of the modules are set up very similarly. They have an introduction. They talk about what the objectives are. They go through different objectives. We tried to make it interactive, and we tried to make it accessible as well. So if there is audio on a screen, it automatically becomes captioned. But if it's if it's written on the screen, we also include the audio as well, in case there's the language different, a reading level difference or something like that. So we worked on that. We're in the process of having our 4 modules put into Spanish currently. And so we hope to have those in the next couple of weeks. As we look to develop more modules, we will have them come out at the same time. They'll be in English and Spanish at the same time and be released. But we were trying to get out a couple of them before our grant year ended, just so we could count them in that 1 year. So sometimes that's the way it works, but in the future, they'll come out simultaneously. I'm just going to pause. I'm just going to check the chat just to see if anybody has any questions. I don't see any, but feel free to, to put something in there. I know a lot of you are family leaders. You develop these type of materials yourselves. So if you have any questions, and again, at the end, I know Hands and Voices has done some as well. And so we can talk about, the development of these leadership training materials and stuff. But the last thing I wanted to kind of focus on was we did a podcast as well. So this was great. We got together a couple of family leaders that were in different points in their leadership journey. So whether they had been with the system and in this work for a little bit longer versus those that maybe were just sort of starting out and starting to see themselves as family leaders. And so we spent a couple of days together and recorded a bunch of them. We dived into some topics really around that idea of, seeing yourself as a family leader and seeing this as a call to work, to everything from, again, we talked about grief during one of them, and what did that mean to each of us. And so we really enjoyed ourselves, and we hope you guys would check that out and see that. Oh, last thing I wanted to talk about is some of our peer-to-peer learning that we do. So we have a couple of groups. We started the Family Center Work Group on Inclusion. So one of the overarching goals for these HRSA-funded genetic programs are really to reach underserved and underrepresented groups. It's really called out. So we really wanted to talk about this idea of a work group on inclusion, and we wanted it to be from that family center perspective, that family's perspective. So we had put out an application, we had people apply. It's a group that meets every month. We really try to have it be a work group where they're really focused on a specific a specific program or a project or something like that. So we can actually have something that will distribute. In the meantime, we did get a lot of applications. So we knew that family leaders are really interested in this topic and how this pertains. So we pulled together a community of practice on diversity, equity, and inclusion. And so we offer that as sort of like a free kind of come in or come out if you have the opportunities. What we do is we tend to read an article that is maybe 10, 15 minutes. And then we get together and we discuss it, and we discuss it from our own points of view, maybe within our family, to, how does it pertain to some of the works that we're doing, right? So I know July was Disability Pride Month. So we read an article on ableism, and we just talked that through and talked about how different, our own individual experiences and how we thought about that. And then as well as like how we could support some of that in the work that we're doing and some of the projects that we're doing in our own little spheres. And then the last thing we do is we do a parent leader office hours for those involved in the RGN. So each of the RGNs have, parent leaders that are involved with each of those 7. And so what we do is we try to offer them the opportunity to come together every other month. We pick a topic that seems relevant. We try to just, again, support that peer-to-peer networking, that peer-to-peer learning, so that they can find out what's happening. And then what as well, if they need support in certain areas, or if we're looking to see different trainings. So last, I just want to put some opportunities for involvement. Again, we hope you guys stay up to date, that you can follow us on the multitude of social media accounts. All of the RGNs, like I said, they actually have projects that are specific to their regions. If you're interested in learning more about which RGN you live in, is covered underneath your state. If you're in one of the states, I'm happy to connect you with them. And then I did just see, I might have overlooked what is an RGN come up in the chat, and that is a regional genetics network. So that is one of the 7 funded projects that cover all of the 50 states. So the regional genetics networks are each, they have their own projects that they work on. They're a little bit different on what they're trying to accomplish. And then lastly, like I said, you're welcome to get on our mailing list for our community of practice. We'd be happy to have you join. And if you want, send me an email on that. And like I said, I can add you to our list. And that's pretty casual. So if you can't make it, you just can't make it. And then you come the next time if you don't have a conflict. Here are all of my contacts, our social media, all of that good stuff. So what I'm going to do now is I am going to stop sharing. I did see somebody ask a question about the podcast, and I will share that in a link through the chat, but I am going to stop sharing. And then I'm going to see if anybody had any other questions, if they wanted to talk about any of our stuff, you know, any of our programs, or like I said, I know some of my other great co-hosts that are on here have done some of this very similar type work. So we're happy to brainstorm or, you know, learn from one another. We're all about that, learning from one another. So